All right. Hi, everyone. It's us again, Dr. Yoktin and myself, Dr. Masinkai. We're back with you again with another episode. We're going to be talking this time about cerebrovascular disease, really spending a lot of time talking about the pathology and a little bit of the clinical aspects of cerebrovascular disease as well. So first, we're just going to have the objectives up here. We'll let you read that on your own time, but we're just going to go right on to the topic at hand. So I think first we want to talk about some terms. So Dr. Goktin, anything to say about these terms that we have up here?
Yeah, sure. Hi, everybody. As far as these terms, since we will be using them quite often here and elsewhere, I think it's a good idea to become familiar with them. Nothing groundbreaking, but when we talk about oxia, we are referring to the presence or absence of oxygen. So low oxygen hypoxia, no oxygen anoxia. And when we talk about ischemia or anemia, now we are talking about perfusion. So obviously when there is ischemia, since there will be no blood coming into the environment, there will necessarily be hypoxia. But you can have a lot of blood rushing in, and you may not have enough oxygen. And the result for the tissue is the same. Usually there is a combination of both hypoxia and ischemia. And that's why in practical use, we tend to refer to the situation as hypoxic ischemic state or hypoxic ischemic injury. And eventually, when the tissue dies, we refer to it as infarction.
So let's go to the next slide here. So this is an example of, I guess, global hypoxia and ischemia. Can you take us through some of the highlights here, please?
So we have two types of general situations when it comes to hypoxic ischemic injury. One is global, and the other is focal, which we will get to soon. Global is usually the brain is a bystander and there is a systemic process going on and the entire brain is influenced by that. Just to go over the picture, we see that there is a collapse of the cortex throughout, except maybe medial temporal lobe. See, it's the relatively normal gray matter here. But all the other areas, it has that dusky tan kind of collapsed appearance, indicating that neurons died there. And it's throughout the brain, including basal ganglia. So we're talking about a global problem. So one thing to consider about this global hypoxic ischemic injury is there is one particular area of the brain that is very sensitive to hypoxic ischemic injury, and that is in the hippocampus. Specifically, the area of the hippocampus termed Sommer sector, SOMMER, also known as CA1 region. CA stands for cornu ammonis, Ammon's horn. Maybe you heard of that in anatomy. So that is if you give me a section and I see that all the neurons in that region of the hippocampus are dead, I can, with good confidence, guess that this patient suffered at some point a global hypoxic ischemic injury. The other thing that I would like to bring up regarding global hypoxic ischemic injury is that these are, as we mentioned, systemic processes. And basically, something happens and the entire brain becomes hypoxic ischemic and will eventually die. So just like a focal infarct, now we have the entire brain undergoing necrosis or infarct. If the patient continues to live or kept alive by being put on a respirator, of course, the body will continue to live, but the brain is dead and will continue to deteriorate and eventually will develop a diffuse edema and discoloration, very brown, typical discoloration. And that is basically brain dead state. And it is also called respirator brain. Not because respirator caused it, but respirator allowed it to occur because the brain was already dead. And if you keep the patient alive, it continued to progress in this infarct state. And it is called the respirator brain. So that's another term you may run into, and I wanted to throw it in there.
So here we have an example of laminar necrosis. So what exactly does that mean, and what should we be looking for if we see that term and see this picture?
So laminar necrosis refers specifically to the necrosis of the infarct. In fact, certain layers of the cerebral cortex die, and we can microscopically identify it as a very peculiar appearance. That kind of infarct can occur anywhere, but more typically in the watershed zones between major arterial territories. For instance, more commonly between the watershed zones of the anterior and middle cerebral arteries, because these arteries are end capillaries. They don't have connections between them. So when the end capillaries are here, everything is fine, but let's say there is a drop in blood pressure, and therefore there is an ischemic hypoxic state in between these vascular territories. So you will have a laminar infarct there. So these are also called watershed zone infarcts. It is really nothing too special. It is just an appearance, mostly a histologic appearance, and it may represent simply an early stage of a more generalized infarct.
Let's keep going. So as we get into the next section, let's look at this case. So this is a case of a 55-year-old man with the right leg weakness that started 90 minutes ago. So take a second to think about what you think his symptoms look like before we move on to the next part of the video.